Think of education as a general proxy variable for socioeconomic status. So it more or less, in a way, represents your access to healthcare, your income level, access to good jobs, a whole suite of other variables. So when I speak of education, I'm actually speaking of all of these variables. And they actually, as it turns out, have a profound influence on duration of life. Those that are highly educated tend to live much longer, much healthier than those that are less educated. And being less educated today is more lethal now for the people without education than it was just a couple of decades ago. It's not entirely clear why that's the case. And I would also point out that the higher the level of education, even past 16 years of education, acquired after the age of 20, or up to the age of 25, actually produces incrementally more improvements in health and duration of life. Now, in the city of Chicago, they just published a series of life tables showing how long people live in the various communities in the city. And what they demonstrated was back in 1990, there were huge differences in life expectancy, upwards of about 15 years in communities that were adjacent to one another. You would literally cross the street, and life expectancy for the folks in this one community would be 15 years shorter than it was in the community on the other side. And I think one was Hyde Park, where the University of Chicago is, and the other, I think, might have been Washington Park, which is dominated by an African American population that in part is heavily influenced by less education or absence of education. And so the impact on duration of life for these two subgroups is absolutely dramatic. I'd point out that a 1 or 2 year difference in life expectancy is extremely large. A 10 to 15 year difference in life expectancy puts the folks on the other side of the street essentially in a third world country, where life expectancy is roughly the same in some parts of sub-Saharan Africa as it is in this one part of Chicago. Part of what's going on here is access to healthcare, access to food, high levels of obesity and diabetes on one side of the street relative to another. I mean, it's everything that you could think of that influences duration of life is harmful on one side of the street and less harmful on the other side. It's pretty dramatic.